not going to fix anything in this state until we become the majority. Because currently, no one, the current legislator majority, does not even acknowledge the minority Democrats. They don't even allow some of their bills to even be read or even to be logged in with a number. I mean, this is, they just, and I know they've been doing this for probably 25 to 40 years, and they're just used to doing that. And I thought about, yes, we need numbers, and I felt like I'm going to help. I can do this, and I think I can just be another voice for the people of LD19. You have a choice now. You're not going to have one party dominating your life. You need to have another party to help get things done. So that's kind of where I'm at.
And I think I said it yesterday. The healthcare system, the health plans, they don't see who you vote for, right? Like you don't have a different color blood running through your body. When you need care at the end of the day, you need it, and you just don't want to die, or you want to be better, or whatever it is. And so policy, and this is like literally the impetus of like creating this series, Your Vote, Your Health, is because we realize that how much it's come up in so many conversations that we have with these like healthcare startup founders, these physicians that we meet. I'm like hearing you, like what you're saying, from being particularly in rural healthcare in Arizona or anywhere for that matter. Policy and legislation have lasting impacts on how we receive, access, deliver care, all of the things. And there's such a domino effect there. And all of these cuts are going to be devastating in so many different ways. So if somebody like you can make changes even at the state level, that can at least help.
I mean, it's not going to just affect, they think they're going to just knock out, 20, 40, 50 million people and, oh, we're going to be fine. We're not. It's a domino effect. It's not only going to hit the person who needs the care, the hospital that cares for them, the providers that care for them, then it goes down to pharmacy. Well, gee, maybe the pharmacy or the local pharmacy in a community all of a sudden has 10 patients that can't come in and buy their insulin anymore because they don't have any money or they don't have any insurance. So it keeps tipping the tiles down, and eventually it'll, we had a clinic. It was a cardiac clinic, closed one of their rural communities. So now you have to 150 miles to go to Tucson to see your cardiologist. Now, yes, you can change your cardiologist, and that might work eventually. But there are some specialties that is really hard, and not every hospital is going to be able to bring in a cardiologist. You have to have at least 2 to cover 24/7. 300, you got to have coverage all the time.
I got a good education in public schools back in Boston.
I can say my public education is probably equivalent to private school.
Arizona's ranked like 48th or something like that.
Sad.
For education. Like we're near the bottom.
It's so sad.
We're very near the bottom.
Yeah. What a disadvantage our kids have. And the public ed system can be a lot better. And the voucher system is 100% taking. Now, by the way, my nephew, high special needs, access, all techs, long-term care, all the things. He goes to a special school down in Mesa and he uses those vouchers. 100% he needs that. He deserves to have that. But not just anybody who decides that they don't want their kid to go to public school does, in my opinion. They are weakening the public education school system as a whole. So.
And for the record, I am not a party guy. And I wholeheartedly believe that, 60% of the populace it registers as independent. We should have 60% of our candidates independent. That's my personal stance. I just want to put forward that I am not a Democrat, but I stand firmly behind the concept that we have to elect Democrats right now to at least get us back on a path where we can start fixing things.
Yeah.
Because the Republicans are broken.
Yeah.
Thank you. Thank you.
That's my personal stance.
I
am not a Democrat. If things were working properly, I probably wouldn't be voting Democrat, but I will be voting Democrat. Isn't that money supposed to be for public schools?
Right. And most of the people outside of the people that really need it, like my nephew, right? Like where they 100% depend on that to get him into this special school to give him the most, viability of his life as possible. Most of the people that get the vouchers, they're homeschoolers, they're sending them to religious school, whatever they're doing, they have money already, right? And it's the kids and the families that are in the public education system that are being hurt the most, in my humble opinion.
Yeah. Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!